Hi, my name is James Crosby. I'm a PGY3 resident at HCA Florida Brandon Hospital. This is a case report of acute lymphoblastic leukemia secondary to lenalidomide maintenance therapy for multiple myeloma. So a little bit of an introduction here. Lenalidomide belongs to the immunomodulator IMiD drugs, which basically inhibit the secretion of pro-inflammatory cytokines. Their mechanism has not been fully elucidated for multiple myeloma, though it is a common part of a 3-drug regimen for maintenance therapy of multiple myeloma. Though rare, lenalidomide has been associated with acute lymphoblastic leukemia in recent years. The literature shows 17 cases to date. This would be the 18th case. Here we present the case of a 71-year-old male who presented to the office for routine follow-up of multiple myeloma. His past medical history is only significant for multiple myeloma. 6 years ago, the patient underwent melphalan conditioning with autologous stem cell transplantation. Following this and a documented response on bone marrow biopsy, the patient underwent maintenance therapy with lenalidomide, bortezomib, and dexamethasone for 6 years. Through routine follow-ups with the infusions, the patient was never found to have any significant abnormality, though on the visit on 6 years after the patient had pancytopenia, which showed up with a white blood cell count of 1.25, which was 56% lymphocytes and 29% neutrophils, which showed a significant neutropenia. The patient subsequently underwent bone marrow biopsy to see if this was a relapse of his multiple myeloma or if it was some kind of leukemia. It favored another leukemia. The the bone marrow biopsy subsequently showed the hypercellular marrow with 95% lymphoblastic leukemia. Chromosomal analysis revealed that the patient had a masked double low diploidy. FISH was done for the MYC gene, the BCR-ABL1 rearrangement, and the KMT2A. All these were negative, especially with the BCR-ABL, makes it a little less treatable. So I posted some of the pictures right here so you could see the TDT staining of the hypercellular bone marrow as well as the CD20 staining. And here's the chromosomal analysis in figure 3. So basically, the clinical course, the patient was referred to a local leukemia specialized center where they kind of took over his care. He showed up at our hospital from time to time for needing transfusions. He did have significant cytopenias due to the induction therapy he underwent. He subsequently passed away due to the toxicity. So the discussion going on with this, as I had stated previously, there's no real mechanism that's been elucidated of the IMiD drugs. However, a potential mechanism of why this works in multiple myeloma is lenalidomide alters the selectivity of cereblon, which causes it to bind tighter to, which causes it to ubiquitinate and do proteasomal dependent degradation of the transcription factor. So it kind of binds tighter to IKZF1 and IKZF2. Which is necessary for the effect on the myeloma cells. Upon further literature search, IKZF1, has been, these deletions have been associated with poor prognosis and is part of the genetic profile for acute lymphoblastic leukemia, especially in pediatrics. And one NAGM article showed that it was a very frequent event in BCR-ABL1 positive ALL and the progression of CML to lymphoid blast crisis. So this suggests a possible mechanism of IMiD-induced lymphoblastic leukemia. This was a prior case series. There was a prior case series published documenting lenalidomide-induced ALL. Now, it's unsure if this could be due to a class effect of the IMiD drugs or lenalidomide itself, because all the published case reports are due to lenalidomide. There is a newer immunomodulator known as pomalidomide or Pomalyst. which is now, part of the treatment regimen for multiple myeloma. There is no association with this in acute lymphoblastic leukemia on PubMed. I typed in pomalidomide, acute lymphoblastic leukemia, and I could not find any studies that were showing a possible mechanism between the two. However, further study will need to be done evaluating this effect.